Hello friends, as every day we are discussing today also we are here with the MCQs. So yeah, the first question is, it's a 45-year-old female patient was admitted with a history of cough, multiple subcutaneous nodules with weight loss for 3 months. What is the investigation of choice for evaluating this patient? I will repeat, it's a 45-year-old female patient who was admitted with history of cough, multiple subcutaneous nodules and weight loss for 3 months. What is the investigation of choice for evaluating this patient? And the options are CT, MRI, bronchoscopy and it's a thoracoscopy. So I think am I audible to all? Yeah, am I audible? Okay, yeah. The question is, it's a 45-year-old female patient who was admitted with a history of cough, multiple subcutaneous nodules with weight loss for 3 months. What is the investigation of choice for evaluating this patient? And the options are CT, MRI, bronchoscopy, thoracoscopy. Basically, it's a case of lung. And so, what will you prefer in lung? That is CT, MRI, bronchoscopy, or thoracoscopy. Anyone would like to answer this? What will you prefer in a patient with lung? That is lung cancer. You can tell CT, MRI, bronchoscopy, and thoracoscopy. Okay, I will only tell the answer. The answer is CT, because in lung carcinoma and all, normally for lung we do CT. As in COVID also, we normally do CT. And if you are planning for MRI, it should be only one indication there for MRI. That is, it's a superior sulcus tumor or pancreas tumor. Otherwise, you do CT for lung cancers. So yeah, cardiac CT, CT we do. And bronchoscopy, thoracoscopy we can do if it's basically it's come in the trachea. Otherwise, normally we do CT only. Next question we have, the number of muscle fibers per Golgi tendon organ is, and the options are 3 to 20, 200 to 300, 50 to 60 or 80 to 100. I will repeat, it's a number of muscle fibers per Golgi tendon organ is 3 to 20, 200 to 300, 50 to 60 or 80 to 100. So you have to remember this, there is no choice for you. So yeah. So am I audible? My video is clear? Just tell me that. Right, and there is some problem. Okay, I'll repeat, the number of muscle fiber per Golgi tendon organ is 3 to 20, 200 to 300, 50 to 60 and 80 to 100. So the answer here is 3 to 20, because you have to remember, it's audible I think, So it's a number of muscle fibers per Golgi tendon organ is 3 to 20 is the answer. So first I will tell what is Golgi tendon organ. Basically, it's a consists of net-like collection of knobby nerve endings among the fascicles of tendon, and there are 3 to 25. What is the answer here? And the fibers form the Golgi tendon organs, make up the LB group of myelinated, rapidly conducting sensory nerve fibers. Basically, it's a part of nerve fibers, and we have 3 to 20 muscle fibers per Golgi tendon organ. So next we have, ouch disease is due to the toxicity of which of the following? Options are thallium, cadmium, chromium and zinc. I will repeat, ouch disease is due to the toxicity of which of the following? Thallium, cadmium, chromium or zinc. Anyone would like to know how to differentiate between CT and MRI? How will you differentiate? MRI will basically look for muscles. Muscles is for muscles and CT is basically for bones. So if you want any bony structure, so you will prefer a CT scan. For like bones also you prefer that. And if you want to see basically the muscles, the tendons and all that, so you will go for MRI. But in case of lung, which I was discussing, you do a CT because the muscles are not that much, you have to see the bony structure as well. So your CT is preferred over MRI, and MRI we do only for pancreas tumor and subsulcus tumor. So so to differentiate, if you look at a CT or MRI also, when you differentiate that, you can differentiate by the color. Basically hypodense in CT it is, I think hypodense in MRI like that it is, I don't remember at that point. But CT we do for lung as well as for bone, and MRI for any muscle you want in the body. Muscular structure. What I was telling, ouch disease is due to the toxicity of which of the following? Thallium, cadmium, chromium and zinc. So what is ouch? It is Itai disease. It's from Japan. So yeah, it's a ita disease, also called as ouch disease. And what is the, I was telling, it's which of the following will cause this toxicity. So yeah, the options are thallium, cadmium, chromium and zinc. So anyone want to answer this? Cadmium. Yeah, cadmium is the right answer. So yeah, ouch or ita disease, it's due to the nephrotoxicity caused by cadmium. So you are right. Yeah, cadmium is the right answer. We have to remember this. It has been left out. It's not required. So yeah, next we have which of the following is the debranching enzyme. So it's a glycogen synthase, glucose-6 phosphatase, amylo 1,6 glucosidase, amylo 1,4 or 1,6 transglucosidase. It's a biochemistry question, so you have to, there is no choice basically. So I will repeat which of the following is a debranching enzyme: glycogen synthase and glucose-6 phosphatase, amylo 1,6 glucosidase or amylo 1,4 1,6 transglucosidase. So yeah, anyone wants to answer this? This, there is a choice for you. Okay, then I will tell the answer. I think most of them will know or I don't know. So yeah, the answer here is C, that is amylo 1,6 glucosidase is the answer. It's a debranching enzyme. Yeah. So nothing to, no concept is here. So yeah, next we have during a school health camp, a group of 250 students are arranged in a ascending order of their height. So which student would have the 48th percentile value for height? So the options are 88, 48, 100 or 140. So I will repeat, it's during a health camp, a group of 250 students are arranged in the ascending order of their height. So which student would have the 48th percentile for height? 88, 48, 100 or 148. Anyone would like to try this? It's a 250 students and 48th percentile value for height will be what? 88, 48, 100 or 140. That's the formula for this, that is R is equal to P by 100 into N plus 1. If you know the formula, then only one. So is anyone? Okay, I will tell. See, R is equal to 40 by 100 because 48 percentile they are given. It's R is equal to 40 by 100 into 250, that is number of students, plus 1. So it's come to around 100. So it's a 100 percentile. So without knowing the formula, you won't be able to tell. So yeah, the formula is R is equal to P by 100 into N plus 1. N is the number of students and P is what you want, that is the 48th percentile here. So roundly its answer is 100. Next we have a 25-year-old woman has complaints of lower abdominal pain and vaginal discharge. On microscopy, the following finding will be present. So what is the selective culture media used to isolate the causative organism? And the options are culture on Thayer-Martin media, culture on McCoy cells, culture on bilayer human blood agar, or culture on varicose lines. So see, they have given one picture also. Basically, if I tell the picture, you won't. Okay, the picture shows it's iodine stain inclusion bodies. So first, anyone can tell what is the diagnosis without that. See, I'll repeat the question. It's a 25-year-old woman who complains of lower abdominal pain and vaginal discharge. So on microscopy, you have the following finding, and what is the selective culture media used to isolate the causative organism? So see, it's finding on microscopy is iodine stained inclusion bodies. So okay, I'll tell the diagnosis itself. It would be confusing for you. So diagnosis is, it's basically Chlamydia trachomatis. So now you can tell which of the substance of the culture you can use. Culture on Thayer-Martin, culture on McCoy's, or culture on bilayer human blood agar, or culture on varicose. It's a Chlamydia trachomatis. Anyone can try at least. Okay, I will only tell. It's basically B is the right answer. That is culture on McCoy cells for its Chlamydia trachomatis. So next we have which of the following is the gold standard investigation to measure vessel wall stiffness in patient suspected to have hypertension mediated end organ damage. And the options are ankle brachial index, carotid angiography, pulse velocity, or femoral artery Doppler. So yeah, I will repeat the question. It's which of the following is a gold standard investigation to measure vessel wall stiffness in patient suspected to have hypertension mediated end organ damage. So the options are ankle brachial index, carotid angiography, pulse velocity, or femoral artery Doppler. So anyone wants to try at least? Yeah. How will you measure basically large artery stiffness? So yeah, the answer here is A ankle wrinkle, what I also thought, but it's not the answer. Answer here is C, that is the pulse wave velocity. Carotid femoral pulse wave velocity is the gold standard for measuring large artery stiffness due to hypertension. So the answer here is C, that is the pulse wave velocity. D is also not the answer. Answer is C, that is, I told pulse wave velocity. See, carotid ultrasound, ankle breaker precedent is also they have given, but yeah, gold standard is C. So you don't have, it's C only. It's pulse wave velocity for stiffening of the blood vessels. So next we have, what is the most common anatomical position of appendix? That this hand I can tell. You can also tell. It's parasitical, post-ileal, retrositial or pelvic. So what is the most common anatomical position of appendix? Parasitical, post-ileal, retrositial, pelvic. Yeah, please tell this. I also know this. What is the most common anatomical position of appendix? Parasitical, post-ileal, retrositial, pelvic. I will have to the answer. You have to remember this. Anyone? Okay, the answer here is C, that is the retrositial is the most common position of appendix. And we have in retrositial, we have pelvic, subsitial, post-ileal. Yeah, retro is the right answer. So the retrositial is the most common anatomical position of appendix. Yeah. So next we have, which of the following is used in the treatment of patient with asymptomatic intestinal amoebiasis? And the options are metronidazole, tinidazole, paromomycin and tetracycline. So basically it's a case of asymptomatic intestinal amoebiasis, and the options are metronidazole, tinidazole, paromomycin, tetracycline. I think we have done yesterday only. We have done, I think. It's asymptomatic intestinal amoebiasis. So what will you give basically? Metronidazole, tinidazole, paromomycin or tetracycline? Yeah, anyone? Okay, the answer here is C, that is paromomycin is the right answer. Basically for luminal amoebiasis you give paromomycin. And I think overall it's metronidazole, but yeah, for luminal amoebicide it's paromomycin is the right answer. So yeah, next we have, what does Billings method of contraception refer to? Options are basal body temperature method, cervical mucus method, calendar, or it's a coitus interruptus method. Paromycin, yeah, paromycin was the right answer. So we'll repeat, what does Billing method of contraception refer to? Options are basal body temperature method, cervical mucus method, calendar method or coitus interruptus method. This if you can guess at least, because Billing method is what? Anyone? Okay, I will only tell the answer here is B, that is the cervical mucus method. Basically Billing method of contraception refers to the cervical mucus method, and it is also called as ovulation method. So yeah, basically it's you can tell that the cervical mucus changes during the menstrual cycle, the whole cycle, and when exactly it changes you can detect that. And yeah, basically the female partner can predict the fertile period by examining her cervical mucus, and so that abstinence is advised during the 4 days wet, that is during the wet days till 4 days after the peak day. That is during the 4 days you don't have to do the sexual intercourse. So yeah, it's a cervical mucus method. So you have to remember it's a Billing method, it's cervical mucus method. So yeah, next we have a patient with ALN is found to have T922. So what will be the size of BCR-ABL fusion protein produced? And the options are 210, 190, 230 and 170, and the unit is kDa, that is kilodalton, you can tell. So yeah, I will repeat, a patient with ALN is found to have T922. What will be the size of BCR-ABL fusion protein produced? 210, 190, 230 or 170. You have to, if you know, then only you can tell this. Otherwise, you can just guess it. Yeah, anyone? Okay, yeah, the answer here is B, that is 190 kilo delta. This KDA is what? I think delta. I don't remember the unit. Okay. So yeah, the its answer is 190 kDa, and if it is 2110, it's CML. It's 190 ALL. 230 is myeloproliferative neoplasm. So you have to remember this. 190 is ALL, 2110 is CML, and 230 is myeloproliferative neoplasm. So yeah, next question we have. Which of the following cytogenetic changes suggest a favorable prognosis in patient with CML? And the options are T11q23V with diverse MLL fusion genes. Then we have normal karyotyping with mutated NPM. Then activating mutation in FLT3 or inversion. So yeah, I will repeat. Which of the following cytogenetic changes suggest a favorable prognosis in patient with AML? Its options are T11q23V with diverse MLL fusion genes, normal karyotyping with mutated NPM, then activating mutation in FLT3 or inversion. So yeah, you can try this, but I also don't know. Yeah, anyone? The answer here is B. Yeah, if anyone can try this. Okay, the answer is B, that is normal karyotyping with mutated NPM is the right answer. So it's indicates a favorable prognosis in AML. So you have to remember. I also didn't know this. So favorable prognosis is by normal karyotyping with mutated NPM. Next we have a man comes to you who has been caught peeking into his neighbor's intimate moments, was served a restraining order. On evaluation, he is found to have a case of scopophilia. So according to DSM-5, what is the minimum age at which this condition can be diagnosed? Options are 14, 16, 18 years or no age limit. So yeah, I will repeat. It's a case of scopophilia. And according to DSM-5, what is the minimum age at which the condition can be diagnosed? 14, 16, 18 or no age limit. Yeah. Anyone can try this? It's a forensic question. Basically, you can tell voyeuristic disorder. Voyeuristic, like you are seeing peeking to someone's neighbor's intimate moments. Basically, yeah. So yeah, the answer here is C, that is 18 years. Yeah. So 18 years is the age limit for voyeuristic disorder, and according to DSM-5. So you have to remember this. At least 18 years, persisting for at least 6 months, and sexual gratification is observed from an individual who is undressing naked or engaging in a sexual activity. So yeah. Next we have, what is the first line treatment for infantile spasm associated with tuberous sclerosis? Options are ACTH, vigabatrin, glucocorticoids or sodium valproate. I will repeat. What is the first line treatment for infantile spasm associated with tuberous sclerosis? And the options are ACTH, vigabatrin, glucocorticoids, sodium valproate. Yeah, 18 years was the right answer. So in this, if you can tell, it's a case of infantile spasm and with tuberous sclerosis. So what is the first line of the drug? Okay, I will only tell. The answer is vigabatrin. Basically, you can tell ACTH also, but vigabatrin we say because it's associated with tuberous sclerosis. So if it's not associated with tuberous sclerosis, only infantile spasm you see, you can give ACTH. Otherwise, with both other, you have to give vigabatrin. That only. So next we have a 50-year-old woman presents with brownish red flat top prurited papular eruption over her limbs and trunk with sparing of the face and abdominal flexures. So what is the most likely diagnosis you have to tell? And the options are dermatophytosis, lichen planus, papuloerythroderma of Fuji, Norwegian scabies. So yeah, I will repeat the question. It's a 50-year-old woman presents with brownish red flat topped prurited papular eruption over the limbs and trunk with sparing of the face and abdominal flexures. What is the most likely diagnosis? Dermatophytosis, lichen planus, papuloerythroderma of Fuji or Norwegian scabies. So yeah, at least try if you don't know the answer. Yeah. Okay, it's anyone? I'll only tell the answer here is papuloelectroderma of Ophusi. Why? See, if you see a condition which has sparing of the abdominal flexures, you have to say it is this one, that is, it's a deck chair sign, which is classically for this papuloerythroderma of Ophusi. So typically what I told, it's brownish red flat top papules, and limb and threads are affected, and face and flexures are spares. So yeah, next question we have. See, flat electrooculogram, that is EOG, is an Arden ratio of less than 1.85, less than 1.5, less than 1.25, or less than 1.2. So I repeat, it's a flat electrooculogram, that is EOG, is an Arden ratio of less than 1.85, less than 1.5, less than 1.25, or less than 1.2. Anyone? If you want to try. EOG is basically, it's a standing potential of the eye. It's an opthal question. Now what is Arden ratio? It's a ratio between the light peak and dart through in an EOG. So normal is like 1.85 and above, and flat, if it's what they have given, it's a flat is basically less than 1.25. The answer here is less than 1.25. You have to remember this. So there is no choice for you have to remember, it's a flat electrooculogram, it's less than 1.25, the Arden ratio, and normal is 1.85. So yeah, next we have 1.8 kg neonate is born to a 24-year-old prima gravida with no antenatal checkups. While calculating the physical maturity of the neonate by the new Ballard scoring, which of the following criteria would you not take into account? The options are skin, lanugo hair, palmar surface, or breast. So basically it's a neonate 1.8 kg born to a 24-year-old prima gravida, and she doesn't have any antenatal checkup. And while calculating the physical maturity by a new Ballard score, what is the following criteria would you not take into account? Skin, lanugo hair, palmar surface, or breast. Anyone can try at least. So yeah, it's what I was saying, it's a new Ballard score, and in new Ballard score we don't take into account skin, lanugo hair, palmar surface, and breast they have given. So yeah, but we don't take into palmar surface. It's not a component. Basically, it's not a component for Ballard scoring for the prematurity. Basically, it's for maturity of the neonate. So what are the physical criteria I will tell from here? It's skin, lanugo, eye or ear, palmar crease. It's palmar crease and not palmar surface, what is given in the question. So yeah, palmar crease, breast and genitals. It's skin, lanugo, eye or ear, plantar surface, and breast or genitals in the new Ballard score. So next we have a 10-year-old boy with COVID-19 comes to you with sore throat, rhinorrhea, and cough, and he does not have fast breathing. So what is recommended for this child? So this I think everyone can tell. It's home isolation, hospital admission, awake proning, antibiotics, or low dose steroids. Basically it's a multiple choice question, and then they have told it's a 10-year-old with COVID with sore throat, rhinorrhea, and cough, and there is no fast breathing. So what is the recommendation for this child? Home isolation, hospital admission, awake proning, antibiotics, or low dose steroids. So yeah, it's a multiple choice is an answer. See, 10-year-old with COVID-19 with sore throat, rhinorrhea, and cough, no fast breathing. So yeah, I think it's anyone? It's easy if it's a COVID-19 case. So yeah, the option is home isolation, because see, it's sore throat, rhinorrhea, and cough is there, but there is no pneumonia, there is no breathing problem. So yeah, it's only home isolation is the right answer. But hospital awake and antibiotics we don't give. So yeah, next we have which of the following is the most accepted theory for secondary isolation. Yeah. So which of the following is the most accepted theory for secondary cholesteatoma, that is ENT? So presence of congenital cell rest, basal cell hyperplasia, squamous metaplasia, or migration of squamous epithelium. So I repeat, it's which of the following is the most accepted theory for secondary cholesteatoma? Presence of congenital cell rest, basal cell hyperplasia, squamous metaplasia, or migration of squamous epithelium. So yeah, we have learned in ENT this most accepted theory. Okay, yeah, I know this. It's D. Basically, it's migration of squamous epithelium, which was the most accepted theory for secondary cholesteatoma. It's also called as Haberman's theory, and it proposes that the skin of the external auditory meatus grows or migrates into the middle ear through the posterior superior marginal perforation or attic perforation from the colostoma. So so the answer here is migration of squamous epithelium. Next we have, say it's a middle-aged destitute is brought by the police and ambulance service to the emergency room, and he is screaming about the birds crawling on his body, but no such birds are noted. A white powder is found in his pocket, found to be a drug. Which of the following statement is not true about this drug? Basically it's a psychiatric question, and thus they are telling it's person is having something. Basically he's thinking that some birds are crawling on his body, but there is no, it's basically not. So what is the drug which is white in color in his pocket? So the options are: produces meiosis, strong vasoconstrictor, has abuse potential. It's not true. Okay, abuse potential, metabolized mainly by liver. So anyone can tell what is the drug basically? Because drug will have this. Basically it's a hallucination case, that to get total hallucination, because he is thinking that birds are present in his body but it's not there. And the white powder, it's mostly what? In India or anywhere you can think what is a white powder? Anyone? It's cocaine, yeah, it's cocaine. So it produces mydriasis and not meiosis, because they have given in the option it's meiosis, it's not meiosis, it's mydriasis. It produced, it's a vasoconstrictor, it's a abuse potential and metabolized mainly by liver. And a tactile hallucination are a type of psychosis in cocaine addicts, and it's known as Madden syndrome. So you have to remember this, it's cocaine and Madden syndrome will have tactile hallucination. So it's a vasoconstrictor and all that abuse and all, I told you. Then we have, which of the following is an anti-inflammatory cytokine involved in wound healing? IL-1, IL-6, IL-8, IL-10. So if you know the answer only you can tell. So which of the following is an anti-inflammatory cytokine involved in wound healing? IL-1, IL-6, IL-8 and IL-10. Anyone? Anti-inflammatory cytokine. Okay, I think no one knows. It's anyone? It's IL-10. So IL-10 is anti-inflammatory cytokine, whereas other IL what they have given, it's 1, 6 and 8 are pro-inflammatory cytokines in wound healing. So you have to remember this. IL-10 is the only which is anti-inflammatory cytokine. Next question we have. See, here is the following cause of neonatal mortality from maximum to the least, according to the verbal autopsy report 2010 to 2013 data. So the option what they have is prematurity and low birth weight, birth injuries and birth asphyxia, congenital anomalies and sepsis. We have to basically arrange them in order of neonatal mortality from maximum to the least. I think you won't be able to tell, but I will tell the answer here. I'll tell the option once again. It's prematurity and low birth weight, birth injuries and birth asphyxia, congenital anomalies or sepsis. So what is they are told in from maximum to minimum, that is the descending order we have to tell. Anyone? Usually mortality from descending order. So the answer here is, okay, the most common cause of mortality in neonates. Anyone? Prematurity and low birth weight. Okay, it's neonatal mortality. I thought it's that. Well, okay. The question is neonatal mortality from maximum to least. So it's one, that is the prematurity and low birth weight is the maximum, which we call mortality. Then we have birth injury, birth asphyxia, and then congenital anomalies and sepsis is the last. Malnutrition is not there in the question itself. So it's a prematurity and low birth weight. Then we have birth injury and birth asphyxia. Then we have sepsis, and last one is congenital anomalies for neonatal mortality. I thought it's a birth injury, birth asphyxia, but with birth asphyxia, what I know is the most common for mortality. But they have given it's prematurity and low birth weight, and then birth injuries and birth asphyxia, and then sepsis, and last one is congenital anomalies for the neonatal mortality. Next we have, which is the most common type of dislocation of hip? You can tell. I think anyone can tell this. I will repeat the most common type of dislocation of the hip. Anyone can tell it's posterior, anterior, central or medial? Anyone can tell this. What is the most common type of dislocation of the hip? I want this answer because most of you will knowing it's posterior, anterior, central, or medial dislocation. Okay, I will only tell him. The answer is posterior. Posterior is the most common for hip dislocation. And others are there, but it's the most common. Yeah, posterior is the right answer. So next we have, there is an outbreak of chickenpox among the children at a daycare center. So what is the most common extracutaneous site of involvement of this disease? Liver, CNS, joint, lung. Basically it's a chickenpox and it's in children, and the most common extracutaneous site of involvement of this disease: liver, CNS, joints and lung. Anyone can try? Because we know chickenpox basically is dermatitis skin, but what is the extracutaneous? Most common extracutaneous disorder for chickenpox: liver, CNS, joints or lungs. Anyone? Okay. The answer is CNS. We all know it's like varicella zoster virus also affects CNS. Because in future also when it's a reactivation of the varicella zoster, it causes CNS. No, joints is not the answer. CNS is the right answer. So the most common extracellular extracutaneous site of involvement by varicella joints zoster is in children is CNS, central nervous system. It's a benign complication. You have to remember this. And the most common serious complication of varicella is varicella pneumonia. Okay, extracutaneous is CNS. Last question for today. It's a 72-year-old patient who is suffering from a stroke and is unable to swallow food. So on examination, gag reflex is absent. The motor nucleus of the vagus nerve involved here emerges from the dash of the brainstem. So the options are posterolateral sulcus, anterolateral sulcus, body of the pons, and the pontomedullary junction. So I will repeat, it's a 72-year-old who is suffered from stroke, unable to swallow food. Examination, gag reflex is not there, it's absent. The motor nucleus of the vagus nerve involved here emerges from dash of the brainstem. What is the dash basically? Fill in the blank. It's posterolateral sulcus, anterolateral sulcus, body of pons, or at the pontomedullary junction. Your last question you can just try. Yeah, anyone can tell the answer? Pontomedullary junction, no. Its right answer is A, that is the posterolateral sulcus, because the motor nucleus of the vagus nerve involved here is emerges from the posterolateral sulcus. It's fibers from the nucleus ambiguous which emerge to the posterolateral sulcus of the brain, and which will cause all these symptoms, that is unable to swallow food, gag reflex is absent. So this you have to know which is that nerve. So yeah, which is that part. So it's posterolateral sulcus. So yeah, we are over with this MCQs. So yeah, thank you so much for joining.